there's always perception. Things we have heard from friends, right? Again, social media, there is a lot of information everywhere. And therefore, before these matters come to you, there is what they have had, their expectations they have. Oftentimes, how do you handle situations when you find yourself in a position that a patient's expectation, a mother's expectation to be exact is different from your own clinical recommendation?
So first thing I do, we cancel their Google subscription. My mothers are not allowed to Google.
Okay.
If you have a question, call me. Do not call your friend, do not call your mother, call me. And if you call your friends or your mother, I will know because you call me freaking out about what they've told you. So there's a lot of information out there, and unfortunately it is usually negative. Okay. So your job as a gynecologist is to reassure these women that, you know what, we have you. Like, there's nothing we have not prepared for. Okay. There are some who will come, maybe this is a precious baby. Precious baby is a baby who, for example, she has had multiple miscarriages, and this time we have gotten pregnant. That mother is completely different from one who has had all these babies. I will call her every day. Have you eaten? Is this okay? Do you feel this? You understand what I mean? And I love C-Care because that is what we do. Like, we check on our patients. We always answer their phone calls. Day or night, there's no gynecologist who will not answer their phone call. We encourage them. A lot of them come in and they're crying because they don't think they can have babies. So my job is to restore their hope. You will have a child. God does not give you the desire and then not give you the child. You understand what I mean?
Yeah.
It might not happen the way you want it to, but it will happen.
Yes.
So it's just supporting them, encouraging them, holding their hands when they need to be held, and we go. Because there's always a situation, there's always an answer or a way for us to be able to help you, even if it is to come to terms with IVF. That is the most painful thing to do. But how you approach it makes it different. Okay, you find some who will tell you, gwe tugenda kuzaala, genda bakole IVF. No. You know, because you have to first read the body language of this woman.
Yes.
Most of them will come in crying. If you see her, like, part of our training as doctors is to read body language. If you see that, if I tell this woman this thing, she might not make it, I hold off. And I wait until she's a bit stable or a bit stronger. And then I tell her that, you know what, unfortunately, this is what is going to happen. But don't tell her without an answer, without a solution. Without a solution. And I thank my team. The gynecologists here are awesome, by the way, because they're always there to support you, to encourage you. Even when you're not sure, they'll be like, let's try this, let's try that, let's, you know. So you're never really alone. And so I do encourage mothers, first of all, to commit. Like, when you come, commit to a gynecologist. Drown out the noise, because there's a lot of noise. This one is better than this one. This one is better than this one. My friend, we are all good. We all went to the same schools. We all studied well. We all studied and finished. But the thing is, do you have rapport? Do you like me? Do I like you? Because there are some patients I will say, please, I don't think so. You see, not because I don't like you, but I know you don't trust me. If you don't trust me, you won't be able to do what is necessary at the time when I need you the most to do. You get, like when I tell you to push and you're telling me, no, take me to theater. That wasn't our plan. You see, so it's very important that as much as patients think they choose us, we choose them. We are not, we choose them because we want them to, you don't want someone who can't listen to you or understand where it's coming from. But also I hope that we do explain well when these patients ask us these questions.